We've heard a lot this evening about urban design and buildings and open spaces, but we mustn't forget about transport, which of course has a key role to play in the question of urban design and mental health. And so we are delighted to finish off this round of presentations by hearing from the President of Active Transport for Cities, previous Chief of Commuter Services for Arlington Department of Transport, and has been called the Active Transport Guru. He is here tonight to tell us what transport has to do with mental health. Take it away, Chris.
Thank you. So in a typical North American city, 25 to 50% of the land area of that city is streets and sidewalks. On the lower end of the scale, in New York City, it's about 28%. In Chicago, DC, and Portland, Oregon, it's 42, 43, and 47%. Former New York City Transportation Commissioner Jeanette Sedek-Kahn, who is like a rock star in the transportation world, said, "Streets are some of the most valuable resources that a city has, and yet it's an asset that's largely hidden in plain sight." If we're going to address mental health and urban design, we have to take into account that huge asset, that 25 to 50% of our streets that are our cities. So this is what we typically build in America, right? And you know, we're coddled here in DC. We live in a nice place in a very nice urban form. But this is typical American city. And it's what we design, and it's what we build for. And it's made for cars, and it's made to speed the cars through. Look at that. It's made that way because we've built these car-dependent, dispersed, and isolated places, right? We've had a century where legal codes and planners, people like me, have prescribed that you work here, you live here, and you play and you shop over here. So research tells us that these car-dependent places are bad for our physical health. That we've known for a while. They add unhealthy pounds to our bodies. They give us heart and respiratory issues. They actually shorten our lives. Research tells us that these kind of places, because they're made for speed, are less safe, not just for people who bike and walk, but for people in the cars too. So there's this new emerging research in mental health, much of it brought to light by the Happy City author Charles Montgomery. And it tells us that these car-dependent places cause us more stress, right? The stress exacerbates our physical health and our mental health. Research tells us that long car commutes are more likely to make us experience rage, fear, depression, and that people who have long car commutes are more likely to get divorced than people who walk, bike, or use public transportation. This emerging research in mental health tells us these car-dependent places make us feel isolated, less connected to one another, which makes us less trusting of one another, and ultimately, it makes us less happy. So what's the prescription? We need to make it easy for people to walk, bike, and take public transportation. We need to build compact, dense, mixed-use places. But we can't keep building on these car-centric models of the past 100 years. We need to flip that. We need to prioritize walking, biking, and public transportation. It starts with that 25 to 50% of our built environment, that great asset that we've got. And it starts with using that to build streets and transport for people, not cars. So what does that look like? Streets and transport for people means prioritizing people who walk. It means making skinny streets. It means reducing the lanes of our cars, our car lanes, from the 12 foot that traffic engineers prescribe to 9 or 10 feet because it slows everything down. When you slow things down, everything's safer. It means two-way streets, not one-way streets, because again, two-way streets are slower streets. It means narrow crosswalks. It means mid-block crosswalks. It means places for you to rest, places for refuge. Streets and transport for people means prioritizing people who bike. It looks like lots of bike lanes, right? But it means putting in bike lanes like DDOT has done on 15th Street and L Street and M Street, where the bikes are protected from the traffic. But it can't just be that sort of one-off project. We don't do enough of these. In Europe, they build whole networks of protected bikeways, and you see everybody biking. It means bike share, because bike share is a gateway drug to get more people biking, right? More people biking, more people on the street means it's safer, not just for the people who bike, but it also is safer for the people in the cars. And it means sometimes we have to have the guts to take some of the car parking and convert it to bike parking. In Portland, Oregon, they've done an amazing job of taking away in every little retail strip, no matter whether it's one shop or 10, they take away 1 or 2 car spaces and replace it with 10 or 20 bike spaces, and retail is thriving in Portland because of it. We have to have the guts to do that. Streets and transport for people means prioritizing people who use transit. It means that we treat them with dignity, that we actually care about them, that we give them a bench to sit on. How about even better, we give them a shelter. The shelter should have real-time information, maps to let them know where they're going. In the winter, it should have some heat. In the summer, maybe some cooling. And it should have a big red lane so that only the bus can go there, and so that all the people taking transit have priority over the people in cars. We have to have the guts to do stuff like that. Streets for people means prioritizing people who want to shop, eat, sit, chat, socialize, or just watch each other. It looks like the parklets here in New York, in San Francisco. In San Francisco, they've put in dozens and dozens of these. They've reclaimed parking spaces and put these all over the place, and people flock to them. In New York City, they've reclaimed streets and built pedestrian plazas all over the place with benches, chairs, places for people to sit and congregate. And guess what? People flock to these places, and even retail is doing better as a result. It looks like food trucks and pop-up retail. If our city speaks balancing transportation options rather than prioritizing walk, bike, and transit, it's still car-centric. Think about that. Because the playing field right now in most American cities is still tilted towards the car. So if we balance priorities and just go from here, we're not going to rebalance the system. If we make our streets more people-centered, if we help make it easy for people who want to walk, bike, or take public transportation, our cities are going to be more green. Our cities are going to be more prosperous. They're going to be more physically healthy, and they're going to be more mentally healthy too. And our DOTs can be the catalyst for this change because they control that 25 to 50% of the urban environment. And the Urban Design and Mental Health Center can help our DOTs with new research, right, Layla? And new understanding so that the DOTs can take this challenge on.